A stroke is a life-changing event, physically and emotionally. Simple, everyday tasks may become more challenging or need to be relearned, and you may need more frequent rest breaks. Every stroke is unique, and your recovery will be too. As a trusted resource in your post-stroke journey, we've created step-by-step guides to make some common activities a little easier.
First, if you're shopping for a new appliance, consider front-loading washer and dryers. They are easier for stroke survivor to navigate because they require a smaller range of motions. They can be easily accessed from a seated position or a wheelchair. Here are some helpful tips to make doing laundry easier. Mark your preferred wash setting with colorful stickers or markers. This is especially helpful if you have vision difficulty or memory problems. Remember, laundry is heavier when wet. Wash smaller loads to conserve your strength and energy. Keep your supplies nearby. Make sure they are clearly marked and organized. Buy laundry detergent pots, although they are a little bit more expensive than regular detergent. They are lightweight and require no measuring. Another option, add pumps to detergent bottles to avoid lifting heavy containers. Okay, let's get your clothes clean. When you start a load, remember to separate clothes into piles or different baskets according to colors. For example, make a light pile or a dark pile. Bring piles to your laundry room. Consider using a rolling laundry cart or a smaller lightweight net bag. Choose your preferred wash setting. Place clothes in the washer. Add detergent. Use the cap, measuring cup, or pots. Close door. To dry, open the dryer door with lid and move clothes one by one. Remember, wet clothes are heavy. Close the lid or door. Select your preferred dryer setting and press the stop button. Dry clothes can be placed in a basket. If you have a folding table, fold them first. Take the clean laundry and put it away.
As you adjust to life post-stroke, remember to take it slow and be patient with yourself. Make time for rest breaks, and stop immediately if you experience shortness of breath, excessive sweating, or dizziness.